Hi students, today we will learn about functions of the spinal cord. So these functions can be divided into sensory functions, motor functions and autonomic functions. So three functions of the spinal cord. How it will do? So all of you know that we have vertebrae, 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 5 sacral which is fused and 4 coccyx which is fused. So all these are vertebrae. And coming to spinal nerves, we have 8 cervical spinal nerves, 12 thoracic spinal nerves, 5 lumbar, 5 sacral and 1 coccygeal spinal nerves. What is the spinal nerves? Spinal nerves emerge from the spinal cord as rootlets which join to form two nerve roots. The anterior nerve roots contain motor fibers which will extend from the anterior horn to peripheral target organs. They control the skeletal muscles and the autonomic nervous system. Whereas the posterior nerve roots contain sensory fibers and dorsal root ganglia which transmits the sensory information from the periphery towards the central nervous system. The anterior and posterior nerve roots converge into spinal nerves and then which will split into dorsal and ventral rami. So here you can see this is the cross section of the spinal cord. This is the white matter and this is the gray matter. Here it is the dorsal side, this is the ventral side. You can see here it is the dorsal root. Okay, and this is the red color one is the ventral root. Okay, here they will join to form spinal nerve. Then again they will branch into dorsal ramus and ventral ramus. So spinal nerve is a mixed nerve. That means it has both sensory and motor nerve fibers. So all these will form 5 spinal plexuses which include sensory and motor nerves from the anterior rami. So you can see here cervical plexuses, brachial, lumbar, sacral and coccygeal. Cervical plexuses extends from the C1 to C5. The deep branches, they will innervate the neck muscles and the superficial branches innervate the skin on the neck, head and chest. The cervical plexus also has an autonomic function including controlling the diaphragm and interactions with the vagus nerve. Whereas coming to brachial plexus, it is formed by C5 to T1 which controls the movement and sensation of the upper extremity. Lumbar, it is formed from L1 to L4 which controls the movement and sensation of the abdominal wall, thigh and external genitals. And when coming to sacral, it is formed from L4, L5 and S1 to S4 which controls the movement and sensation of the foot, leg and thigh. Whereas coccygeal is formed from S4, S5 and coccygeal nerve which innervates the skin around the tailbone. So these are the 5 spinal plexuses which are formed from the anterior rami. So you can see here the cervical plexuses which is formed from the C1, C2, C3, C4, C5 anterior rami. Whereas the brachial plexuses they are formed from the C5, C6, C7, C8 and T1 anterior plexuses, anterior rami. Here you can see lumbosacral plexus, lumbar plexus, L1, L2, L3 and L4. Okay. Then coming to sacral plexus, L4, L5, S1, S2, S3 and S4. So you should know about myotomes and dermatomes. So what is myotome? It is defined as a muscle or group of muscles supplied by one spinal nerve root. So you can see here C5 that is helpful for shoulder abduction. C6 helpful for elbow flexion and wrist extension. C7 for elbow extension. C8 for wrist flexion and thumb extension. T1 for finger abduction. T2 to L1 for chest wall and abdominal muscles. L2 is for hip flexion. L3 is helpful for knee extension. L4 is helpful for ankle dorsiflexion. L5 for great toe extension. S1 for ankle plantar flexion, and S2 for knee flexion. Okay, these are the myotomes. So these are the group of muscles which will function as a unit, and these are supplied by one spinal nerve root. So you can here see myotomes C1 and C2 for neck flexion or extension, C3 neck lateral flexion, C4 shoulder elevation, C5 for shoulder abduction, okay, C6 for elbow flexion or wrist extension, C7 for elbow extension, wrist flexion, C8 finger flexion, T1 finger abduction, L2 for hip flexion, L3 for knee extension, L4 ankle dorsiflexion, L5 great toe extension, S1 for ankle plantar flexion or ankle eversion or hip extension, S2 for knee flexion. So here you can see this C2, C3, C4, C5, C6, C8, T1, T2 to L1, okay, L1, L2, L2, L3, 4, 5, 6, all these things are myotomes. Here comes dermatomes. So what are dermatomes? Derma means skin. So the areas of skin supplied by one spinal nerve root is called dermatome. So this is called dermatome. So dermatomes exist for all spinal nerves except for C1. So coming to cervical dermatomes, C2, it supplies the crown of the head, posterior scalp, earlobes and lower jaw. C3 supplies for base of the skull and upper neck. C4 supplies for lower neck and upper shoulders. C5 for clavicle, C6 for thumb, C7 for index finger and middle finger, C8 for little finger and ring finger. Then coming to thoracic dermatomes. T1 for upper chest, back, axilla and upper medial arm, medial side of the arm. T2 and T3 for upper chest and back. T4 at the level of nipples. T6 at the level of xiphoid process. T10 at the level of umbilicus. Then comes lumbar dermatomes and sacral dermatomes. Lumbar dermatomes. L1 supplies for groin, greater trochanter, lower back. L2 and L3 supplies for lower back, hips, anterior and inner thighs. L3 for medial side of the knee. L4 for lower back, anterior thigh, anterior knee, medial calf, medial ankle and medial aspect of the great toe. L5 for lower back, anterior and lateral shin, lateral aspect of the great toe and second to fourth toes, top and bottom of the foot along with 2 to 4 toes. And coming for sacral dermatomes, S1 supplies for buttock, posterolateral leg, little toe. S2 supplies for buttock, genitals and posteromedial leg. S3 supplies for buttock and genitals. S2 to S4 also supplies for perineum, and S5 is at the level of anus. It is very important. So you can see here, this is the dermatomal organization. This figure you should remember: C2, C3, C4, C5, C6, C7, C8, T1 to T12, L1 to L5, S1 to S5, and all these things. This diagram you should practice.